going to turn the time over to Molly.
Okay, hi all. Give me just a second. I'm going to share my screen. Just 1 second. Can everyone see that? Should be a PowerPoint. Okay, excellent. So we're just going to go over, I'm going to start. I typically do these presentations for a variety of different populations, but we'll just start. We're going to go over the basics of COVID and then just some really specific things for, you know, your safety and your at-home safety and things that you can do if you do choose to, you know, leave your home or have individuals over to your home. We'll have a time at the end for you to ask questions, but I think it's a small enough group that if you have a question as we go, please feel free to stop me and ask. I always preface this with my presentations. I am a health educator. I'm not a physician or a medical doctor. So if it's a medical related question, you got to stick to asking that one to your doctor. So just to preface, I'm not a medical doctor. We'll go ahead and get started. Sorry, it's giving a little stall. So again, they said, my name is Molly Signoretti. That is my work phone number, and it's again on the end. You guys are welcome to pass this out. If you have questions, need resources, anything like that, feel free to call or email me. We have quite a few resources at the health department to help individuals at this time for a variety of things, whatever it is that you may be in need of. So basics of COVID. COVID's new. It's a respiratory illness that has been around essentially since December. It belongs to a family of viruses. So COVID-19 actually falls under what we call coronaviruses, which also has, if you've heard of SARS and MERS, also in that same family of, you know, viruses that are linked together. Its main means of transmission right now is through respiratory droplets. So sneezing, coughing, as much as we don't like it when we talk, we often, you know, have respiratory droplets come out. If we're singing, if we're eating, doing things like that, that's the main means of transmission at this time. There is some research on it transmitting through surfaces. How long things last on different surfaces is, you know, still up for researching, as far as, you know, if those respiratory droplets last 5 minutes on a surface or 3 hours. It all depends on the surface. So there is a variety of means of transmission, but the main means of transmission that they have confirmed is through respiratory droplets. The 6 main symptoms that we look for, and this is something as we go into cough and cold and flu season that we're really going to be going into, but those 6 key symptoms are fever of 100.4 or above, a cough, shortness of breath, muscle soreness, and muscle soreness is not I went and ran 10 miles or I went to the gym and did something I've never done, outside of your norm muscle soreness. And then changes of in taste or smell. If you lose the ability to taste or smell, or things start to taste different than they have in the past. And then the last one would be sore throat. As we go into cold and flu season, it will get hard, obviously, because a lot of those are cold and flu symptoms, to kind of differentiate, but assuming that those are the main 6, those are the things you're going to want to look out for. So just a few things. There's about 10 items that we'll just quickly walk through and, you know, kind of go over an example for each of these, but there's quite a few things we can do to help prevent, you know, being susceptible to COVID if you are exposed. So getting an appropriate amount of sleep. If your body is not getting enough sleep, you are often stressed and you're tired, and that often reduces your immune system to protect you against other things. Eating and drinking plenty. So eating nutritiously and getting plenty of fluids is really important during this time. It's really important during cough and cold and flu season as well. So those 2 things combined, we want to make sure that we're doing. Staying physically active is another thing through all of this that can really help boost your immune system and help you prevent, you know, if you do catch it, prevent a severe illness, or if you are, you know, having lots and lots of symptoms, can help you, be a little stronger towards that. Manage your stress levels is number 4. That's a big one. Stress in general diminishes our immune system. So anything you can do to kind of reduce your stress level will help you, protect yourself against COVID, but also as we reach flu season, because we don't want those things combined. A few more. Stay home if you're ill and avoid people who are also ill. These ones might seem a little bit obvious, but as you move forward, if someone is exhibiting a symptom, stay away. If you're exhibiting a symptom, do everyone else a favor and stay away from them. It just helps limit the spread, and we don't essentially want any more spread than we already have currently. Washing your hands, making sure that you're doing that on a regular basis. I like the rule is if you touch something that someone else touched, wash your hands. So if I go and I, touch a doorknob that everyone else has touched, I wash my hands. If I've gone to the store, I sanitize or wash my hands. It's just the safest means. Cover your cough and sneezes, not with your hands. So in an elbow, in a tissue, those things are great. Because we're all wearing masks, you're probably gonna end up sneezing or coughing into your mask, which is better than on your hands where you may spread it to others. Disinfecting frequently touched surfaces, we'll go into that a little further, but basically things that are touched often, bathroom door handles, kitchen countertops, things at your house that other people may have touched, disinfecting them often. And avoiding touching your eyes and mouth. This is a hard one. I know we all do it a lot. And then avoid sharing food or personal items. So if you do have someone you live with or people you're engaging with outside your home, just make sure you're not sharing anything personal or food related. So making sure you're always using a different fork, making sure, you're whatever you're doing with someone outside your household, you're not sharing those items with them. So surfaces that you should be cleaning, these are in your house. So things you can do within your house to just consistently keep the germs away, making sure things like toilet handles, bathrooms, kitchens, there's tons of countertops, remote controls, phones is a big one. If you talk on the phone or you use your phone to text or whatever you may be doing, make sure you're sanitizing that as well. A lot of germs live on our phone. And if we're showing someone a picture, having someone else hold our phone, those things can carry a lot of germs with us, and just wanting to make sure, especially during this time, that we sanitize those items. That goes for, computers and things like that as well. So the county came up with a nice, funny saying, but just make sure it's called Safe 6. We're always staying that 6 feet away from anyone we're engaging with outside your home. Those of you, there was a sex ed campaign that used a similar slogan, so that they came up with something creative for this when they were doing it. But basically anyone outside your home, so someone that you don't live with, not a family member or friend that comes to your house, that doesn't count as a household contact. So someone that you live with, your husband, your kids, your caretaker, that's a household person. You're always with them. You're often engaging it closer than 6 feet. If they're outside your home, always 6 feet away. It takes away what we call a direct contact. So if I have COVID, and I'm just going to explain this and you can ask questions. If I have COVID and my husband comes home, we're often within 6 feet. He would be what we consider a direct contact. He was directly exposed to me within 6 feet, often for more than 15 minutes. They would consider him a direct exposure and ask him to quarantine. Now, he is now the direct contact, but someone he engaged with would not be considered exposed if they had never physically spent time with me. So it is a little bit confusing how that direct contact works, but basically if you're constantly making sure you're 6 feet away from anyone else, you eliminate your risk to need to be quarantined at any given time. That part is a little confusing, I know. So I kind of got ahead of myself, but basically the purpose of that social distancing here is to make sure that we're always 6 feet away. When we're within that 6 feet, that's essentially the distance of those respiratory droplets often travel. The 15-minute rule basically applies to something called viral load. So the longer you're with someone, the more they're sharing with you, the more of the germs, the more of the virus that they're giving you. So that 15-minute window is really important. So if you are going to engage with within 6 feet of someone, make sure it's a very short amount of time. You're wearing proper protective gear, mask at all times. This applies to anyone, whether they're at home, whether they're in, in the community, those types of things. We went over transmission. I'll just skip that one. Testing. This is something I know a lot of people have questions on that I like to go over. Testing is available for anyone with those main 6 symptoms without a referral. So if I have any of the main 6 symptoms, I can visit a testing facility and they will test me. If you've been in direct contact with someone that's positive and you're not directly exhibiting symptoms, you can contact the health department and they can provide a test referral on a case-by-case basis. There are, some facilities that will test you without symptoms, but it is kind of dependent on the facility or lab. And we do have a lot of labs these days that are testing for COVID, which is fantastic. So just be aware that testing is available if you are symptomatic at any point, and we do encourage anyone that's symptomatic to get tested right away. This is a question I also get asked quite often. These are, again, just basics, but can I contract COVID more than once? The short answer is yes. There's no indication at this time that you can have COVID more than once within a 90-day period. So if I got COVID, at the beginning of October, I would essentially not be I wouldn't be at risk for getting it again for 3 months after I'd had it, or 90 days. There is, however, cases starting to populate of people who had COVID and then 5-6 months later got it again. So that is possible. They are still researching how that works, but essentially, it's such a new disease that we're learning about, that window is essentially what they've come up with at this point. So you could say immune for 90 days if you've contracted COVID, but it is possible to get it more than once. Antibody testing. This was a big thing at the beginning, but something I always like to cover for those of us that have questions on it. There is 2 different types of tests. Basically, we're testing for you currently have the condition. This is where you're going and getting a nasal swab. There are a few different tests now, but the main one is getting a nasal swab. That is testing for, do I currently actively have the disease? Antibody testing basically tells us if I've had the disease in the past. It doesn't say when or how long I had it for. It just says I've had it before. This was popular at the beginning. Like I said, now it's not as popular. But basically, if you have been antibody tested because there is proof you can contract COVID more than once, antibody testing would simply tell you if you've had it. It doesn't necessarily provide any immunity towards the disease at this time. If you receive an antibody test and it is positive, meaning it says that you've had COVID, you still need to follow all of the guidelines for social distancing, wearing a face covering outside, making sure that if you're exposed, you quarantine. All of those rules would still apply if you've been tested for antibody. Again, this is not as much of a big thing as it was at the beginning of COVID, because it's kind of phased away as we've discovered that it is possible to contract COVID more than once. So some safety practices, and these ones are just general, and then we'll kind of get into some specifics. But wash your hands, sanitize your hands. Like I said, anytime you touch something someone else touched, wash your hands. The more the merrier. If you're using hand sanitizer, just make sure it's more than 60% alcohol. Carrying that with you, if you do choose to leave your home, is a great choice anytime you're out and are touching things at a store. Something I always like to preface with that is gloves can be a positive thing. However, gloves still collect germs just like your hands. And so basically, if you're touching a grocery cart and then you go and get in your car and you're still wearing the gloves from the grocery cart, you've just now taken the germs from your grocery cart and put them in your car. So you need to change your gloves literally every single activity, so you're safer off hand sanitizing. I use a cart, I sanitize, I get in my car, if that makes sense. So gloves can be beneficial in some situations, but for now, typically I recommend we reserve those for any kind of medical staff at this time and just practice, sanitizing practices of our hands. Stay 6 feet away from anyone you do not live with. This includes your family members. So I do not live near my parents nor my in-laws, and when they come to visit, I still need to stay 6 feet away from them. Yes, they are family, but they do not live with me. And so their exposures to COVID and to other people are different than mine. And by putting us together and being within 6 feet, we're kind of combining all of our exposures into one. So safest to just always stay 6 feet away. So I live with a cat and a dog and my husband. Those are my people I get to be within 6 feet of. Everybody else, I mask and stay 6 feet away from. When you're outside your home, always wear a face covering, especially, if you're indoors, especially that is currently the legislation in Salt Lake County, that you do need to wear a face mask basically in public at all times unless you can maintain that 6 feet. So the example I like to use is if I go to the grocery store, I'm always wearing a mask. If I choose to go for a walk at the park and I can consistently stay 6 feet away, I don't necessarily need to be wearing my mask at that point, but I do have it handy if there is an encounter where I'm spending a little bit more time with people. Again, cover your coughs and sneezes, clean those frequently touched surfaces in and out of your home. And then monitor yourself for signs and symptoms. And this is something you should be doing at home every day. Take note if something has changed every day. Wake up. Do I feel more fatigued? Am I having muscle aches? Do I have a headache today? Just taking note of those things so that you can kind of track yourself over time. As we get into flu season, cold season, our health often changes. So being able to kind of monitor how you're feeling each day and making sure that if you do begin to have any kind of symptom, you take note of what day it is. They're going to ask you that when you're being tested, those types of things. So making sure you're taking a self assessment of your health every day. For some people, writing it down can be really helpful. Putting a smiley or a frowny face based on how they feel can be really helpful as you kind of move forward with cold and flu season in addition to COVID. So some older adult basic tips. A lot of this information has come directly from the CDC. They have a great webpage for those of you that like to read on your own that goes over tons of stuff for older adults, but the basics, if you're over the age, essentially the older you are, it gives a specific age, but basically the older you are, the higher your risk for severe illness. So 55 versus 85, the 85-year-old would have a higher risk of contracting severe illness. So something to be aware of when you are choosing what activities you're going to participate in. Underlying medical conditions, and there's quite a few that go under here, do play a role in the severity of your sickness. So if you have an underlying health condition, when you're choosing your activities moving forward, it is important to just consider those underlying health conditions as you move forward. Again, I'm going to say this a million times, but if you're with people outside your home wearing a mask and staying 6 feet apart at all times, and then engaging, if you are engaging, with your family or someone that lives outside your household, doing it outside is a lot safer than doing it inside. You have a lot more fresh air. We have a lot more space. The transmission rate outside is a lot less than inside, where there's confined spaces. Everyone's breathing the same air. So as we move forward with winter, I know that activity will get harder, but things like outdoor fire pits and, space heater, or not space heaters, yard gas heaters, like propane heaters, those things, if you're going to choose to engage with family or friends, are really fantastic just for being able to engage in a slightly safer way than if you were inside, which as we reach holidays, I know will become a challenge. Limit your visit with others. That's the only one on this one that I haven't gone over, but making sure that if you do, have a dinner or have a coffee with someone, making sure that you're just making social distancing and wearing a mask a norm. I have a friend group that we all still engage. We're always outside. We do a very funny looking circle where we're all 6 feet apart, so we can consistently maintain that. We put our chairs that far apart, and just coming up with really creative ideas on how to continue to maintain, your social interaction and mental health while still remaining safe at this time. And you can do those things often, at your home, at the park, somewhere that's open air for you guys to remain safe. General medical needs, something that's kind of been worrisome during COVID is individuals not continuing their normal medical appointments, normal medical needs. So don't skip your medical care. If you have a doctor's appointment and it is necessary and not something that is just an elective appointment or elective procedure, don't skip it. They've come up with a lot of really great ways to interact with your physicians safely and reduce the risk, but it's really important that just because COVID's going on that we don't ignore any of our other healthcare needs. You can limit your trips to your doctor. They do a lot of phone appointments now. They do a lot of telehealth, which is like what we're doing now, but you'd just be talking to your physician, chatting by email or through whatever platform they use for their medical facility. Limiting trips to the pharmacy. A ton of pharmacies are doing free delivery. So limiting those trips helps limit your exposure to just a general area, but doesn't limit you from getting your normal prescriptions, avoiding things like that. So we want to make sure we're still doing all of those things during this time. Sanitizing, we went over this, but making sure that when you do go into a public space that you're sanitizing before and after, so that you're not sharing and you're not bringing anything home with you. So if you go to the pharmacy or go to the doctor, just make sure you're using those sanitation tools. This is just something that the county goes over, but basically we're still under a mask mandate. It's through the end of the year. As I said, if you're out in public, you gotta have a mask. So that's just the best rule for everyone. Something that I often get asked about masks is, the purpose of them, but basically if I'm wearing a mask, and I'm sure you guys have all heard this, I'm protecting you. And if you're wearing a mask, you're protecting me. I would hate to be the one that spent time with a friend and wasn't wearing a mask and staying 6 feet apart. And maybe I didn't know I had COVID and I gave it to them and they became severely ill. I do not want to be that person. So making sure that you're, I'm sure no one else wants to be that either. So making sure that you are wearing that mask when you are engaging with others. This is just a great, and all of these resources that are up, these little pictograms, are on the Salt Lake County Health Department website, and I can send a link for them. But basically, they're just fun little pictures that kind of reinforce mask wearing. Something, if you have friends or family that aren't really set on wearing them, these can be, some good tools to share with them if they have questions. Quarantine, this is something I do get a lot of questions on. A lot of us are, home all the time anyways. I work from home for the most part, but a lot of us are home. But if we do go out and we are exposed to COVID, there is a 14-day quarantine period, and that means 14 full days. This is just a great overview of what quarantine looks like. So if I was exposed today, my quarantine would start tomorrow and go 14 days. And on the 15th day, I would get to go out. So that just explains quarantine. If you go, out of state or you feel like you were exposed, quarantining that full 14 days can help make sure that you're not sharing anything you may have caught with anyone else. Just a safety measure. For someone who is a direct contact, someone who contracts COVID, if I had COVID and my husband came home, he would need to quarantine 14 days away from me after his last exposure. So just something I like to go over. It kind of explains what's going on and what we're doing from the health department side of things. Some really great resources. The CDC has some awesome guidance for older adults. The National Institute of Aging also has them, but they're very, very similar. The face covering order, if you're interested in reading that, is on the Salt Lake County Health Department website. The CDC, coronavirus.utah.gov is the Utah specific website, and then the county health department. And something I always like to cover regardless of population is when you're reading about COVID, when we're researching, when we're doing anything, when we're watching the news, you engage in social media, making sure that the things that you're reading have quality sources. And the way that I like to do this is if I'm reading a news article on the New York Times, or I'm reading a news article that's linked from Facebook, I go to the resources and I find out where they got their information. So there's a lot of misinformation about COVID out there. Making sure it's from a really quality source is important. So CDC, local health department websites, state health department websites, the World Health Organization, all really quality sources. Most major medical journals, also great, resources. If they don't have sources, I would, take it with a grain of salt and research farther. So just something, when you're learning about COVID, when you're continuing to go through this, make sure that you are, just taking everything and making sure that the sources are quality. Questions? What questions do you have? I know I went over a lot of information. I like to do it very general because I know people have specific questions, but what questions can I answer for you? And if you don't want to speak, you can also type it into the chat box if that works for you. Okay. Go ahead.
I have a question. What about in car travel? So I've been wanting to do some activities with my friends, and we've been meeting each other in cars, and sometimes it's like an hour's drive away. How safe are we in cars? In the
Absolutely, I think that's a fantastic question. So, mask wearing is a must if you're going to, engage in that. Something to preface is masks take away some of the risk, but not all of the risk. So if you are going to be within that 6 feet for more than 15 minutes, if you're wearing a mask, the risk is less, but it doesn't take it all away. So if somebody in the car did have COVID, we would still have everyone quarantined regardless of if they were wearing a mask or not, just for extra precaution. So right now, I would say car trips that are less than 15 minutes, go ahead and carpool, wear a mask. You're safest if you all drive yourselves. It's not very friendly to the environment, but it does eliminate that risk of you guys all being in that very close proximity at the same time.
Thank you.
You're welcome. What other questions do we have?
I have one.
Okay, go ahead.
Actually, it's kind of two.
That's okay.
How accurate are the tests? And if you end up having to need one, is there something to outweigh versus the saliva test and the nasal test?
Yeah, so there's not an exact answer to your first question. So there are tons and tons of labs doing tests based on where your lab test is done. Their accuracy is based on their specific test. Most of them have a very, very high accuracy rate. If you are being tested with a PCR test, so you're being tested with a nasal swab, you're being tested for the disease. If you're going to any of the major labs, so University of Utah, Intermountain, ARUP, if you're going to any of the major labs, any of the labs that the Utah coronavirus or coronavirus.utah.gov website suggests, they're going to be very accurate because there is, ever so slightly differences between their labs. There's lab mix-ups, there's things like that, but most of them they're pretty extremely accurate. Tell me the last part of your question again.
was the nasal versus the saliva test. Is there one that's more accurate than the other?
The nasal one has been around longer. The saliva test isn't necessarily, I mean, it just depends on, it has a lot of more, it has more factors that influence the accuracy because you can't eat right before and then the amount of saliva that you need. So most of them are sticking to the nasal swab. Doesn't mean it's not accurate. You just have to read about the lab that's testing it. So that one is a little bit, I know you can't see my screen. I just exited out of it because I was trying to, somebody populated a question in the chat box. Give me half a second. Okay, I'm going to stop screen sharing for a second so that I can read the chat. So there's quite a few hotspots. I would have to pull up the data for today to view the hotspots. The last several days, Utah County and Salt Lake County have had the highest number of cases. Utah County being particularly alarming, specifically because their percent of the population is lower than Salt Lake's. Yeah, their case count is, you know, not the same, but close. Salt Lake County, because it has the most populace, is most often going to have the most number of cases. There are quite a few hotspots, but I can either send a link or I can post it in the chat window that takes you to the state data dashboard. I can pull that up real quick for you guys. And basically this lets you look at the data as it becomes live and look at all of that information. So I'll just post, this is the state data dashboard that I just posted in the chat if you guys want to save that. And then I will post the county data dashboard, which just is a little more specific to the county. Each have slightly different information, but both really, really helpful in looking at data if you're looking at where specific things are. Some of the things that we're looking at for Salt Lake County right now that have been a little bit, you know, not alarming, but we basically, because we've reopened schools, a significant number is a lot less in age. So before we were kind of seeing middle-aged have a high number. Now we're seeing transmission in younger high school, college-age kids be a lot higher because they are back in school. A crude rate. Okay, so a crude rate is the number, basically it's just the raw number of people per 100,000. So it basically is equated. So if they basically equate it, so like there's the total population of Salt Lake County, it breaks it down to how many people per 100,000 have the disease. So right now, I don't have it pulled up, but right now it's a lot, the crude rate is a lot higher than it was. The number of people per 100,000 that have it is a lot higher. The next question is, how are careful people like us unknowingly picking up the virus? So it's hard to say. You can contract the virus in many different situations. The more careful you are, the less likely, you know, you are to pick it up, but it is possible to, you know, unknowingly pick it up. That's often not always due, you know, to the fact of we're interacting with more people now than maybe we were 6 months ago. We do have what's called symptomatic and asymptomatic patients. So a symptomatic individual is someone who is showing signs and symptoms of illness. I know they're sick, I'm going to stay away. Some people don't show any signs or symptoms. They're called asymptomatic, but they are still carrying the virus and they're still doing what's called viral shedding. And they are, the more time you spend with them, the more they give you. And they may not even know it. So that is hard to say exactly, but just, you know, the more people, the more places you go, the more exposures you have. So if I go to my office and then to the grocery store, I've now exposed myself a little bit more. And then if I go, you know, to the pharmacy, now I have a different exposure. So the fewer places and the limit you have on your friend circle or your interaction circle, the less likely you are to catch it. So for example, for me personally, I have a few friends that I'm comfortable hanging out with outside in open air environments. And I have my little quarantine group, the friends that, I may not have seen in a while, or I don't know how careful they're being. I don't know who they've been around. I may choose to wait and hang out with them or spend time with them, or spend time with them in a different way. So the more people you spend time with, the more exposures you have. That's kind of the basic way to put it. Wearing a face mask and a face shield. So face shields don't do the same thing as face masks. Face shields are going to add that extra layer of protection for any respiratory droplets that could escape for the top of your mask and may protect you a little bit further. It will protect your friends more than it will protect you, obviously, if they share respiratory droplets that can get in through that face shield, but it does add an extra layer. The percent of, added protection, I couldn't say. What else? That was all the questions in the chat box. Anyone else have a question?
This is Paige.
Okay. Oh, Paige, you have to talk a little louder. I can't quite hear you.
Might be just my computer. Is it better? Is it pretty?
Come really close to your computer.
Yeah, it's just low right now. I'll let somebody else ask a question. It'll come back. I'll move location.
Okay, you can also type it in the chat. That may be better. Something that's come up a lot of questions on is, holidays as they're coming up. Obviously, they don't just disappear when COVID's around, but what you choose to do for your holidays does, put you at greater risk depending on what you're doing. So all of these things that we've talked about, making sure that you're safely implementing them during the holidays is really important. So making sure you're choosing your plans wisely, making sure that, your expectations, and this is something that's hard, meets the expectations of the people you're going to be spending time with. Will everybody be wearing a face mask? Will social distancing be practiced? How will we, clean between individuals? Those types of things when you're planning, Thanksgiving, Christmas, whatever holidays you celebrate, just make sure that you're thinking about those things moving forward. The difference between COVID-19 and the common flu. Did I skip a question? Oh no, okay. So they are different. The common flu each year has shouldn't say each year, lots of times has a different strain. So the flu that was present last year may be slightly different strain. This is like when they look at it scientifically, the strain may be a little bit different. COVID is part of a different group of viruses. And basically the effects on your immune system are different. The biological impacts on your body are different. The symptoms are very similar, which is where it gets challenging. The common, what we would say the flu is not the rate of infection and the rate of serious illness or death is not as high in the common flu, which is where we want to differentiate them this year. And that's something that I hadn't touched on, but this year you want to make sure that if you have the ability to be vaccinated, that you are vaccinated and you do get a flu shot. They're doing tons of events everywhere. All the pharmacies, doctors' offices will do them. Picking a place to do your flu shot if you're able is really important. We don't want to be nobody wants COVID and the flu at the same time. You don't want to be sick with the flu and with COVID, but we also don't want to bring our medical system too many cases of either one because that would overwhelm our system. So something that was a great question. The symptoms are very similar. If you're having any of the symptoms, do get tested for COVID because as we share that, it is a little bit more dangerous. Not that the flu is not dangerous, it just it's a little bit different. Thoughts on pulse oximeter to track your symptoms. If this is something you normally do for your health, I would say absolutely. I don't think it's necessary unless you do this for your health normally to track your oxygen. So if you normally track your oxygen in some form for a health condition, I would say by all means you 100% need to continue listening to your physician. On a daily basis, I don't think it's necessary. I would just continue to monitor my symptoms. So if I wake up in the morning, I'm, just going over a quick health check. Did I wake up feeling stuffy? Okay. Did I wake up with a sore throat? Just going through those things, right? During the fire, for example, I woke up stuffy 3 times. It was like, oh no, what's going on? Went away instantly as soon as I, took some allergy meds, the air cleared up, gone. Making sure that I'm just consistently checking over my symptoms. If I had a fever, though, probably can't equate that to, smoke from a fire. I would need to go get tested. What is considered low oxygen? It's different for everyone. Depending on your health conditions, some people have health conditions where their oxygen level does drop a little bit lower. Typically 95% and above is great. It's a little bit different for everyone based on their previous health conditions. Are the symptoms the exact same for what? Sorry, is that for cold and flu for COVID? COVID, is that what? I don't know who asked that question. I'll just answer it as yes. The symptoms are not necessarily identical. Some of them are the same though. So that's why we want to be tested or monitor our symptoms. If we are having just a stuffy nose, that isn't necessarily just enough to get tested. But if I'm having a fever and I'm having a cough, I would get tested. Often they're just right now just saying, get tested if you're having any type of symptom to rule out COVID for that. But the symptoms are very similar. Sometimes all, the same. The 6 main symptoms of COVID are very similar. Some of the symptoms that aren't necessarily seen first for COVID are a little bit different than cold and flu. Testing is free. Yes. So I back up. If you have a medical need to be tested, it is free. So if you are having symptoms or you have been directly exposed to an individual who is positive, testing is free. It should be free to you, but it doesn't mean they won't charge your insurance. So if you're insured, your insurance is required to cover a COVID test. So they may ask you to present your insurance, but insurance they are required by law to cover the test. If you're uninsured, it will be entirely free. Now, if you don't have a medical need to be tested, so you just want to be tested for fun, you left the state, you're going to a new state, they require a COVID test, you're leaving the country. If it is not medically necessary, they may charge you, if that makes sense. So basically, if I chose to go to a European country that would let a US citizen in right now, there's not very many. I would probably have to pay for the COVID test. Now, if I had a cough and a fever, I wouldn't need to pay for my test. Hopefully that clarifies it. If you need a COVID test, if you're having a symptom, the best place to start is coronavirus.utah.gov. There is a link on there that takes you to the testing sites, and you can call it asks you for your zip code, and it will populate the ones that are closest to you, and you can call them and ask their procedure. Most of them, if you're having a symptom, you just go directly to the testing site. So if I went to the university site right by my house, I would just call, sometimes make an appointment depending on their procedure, call and then go there. It is possible to be tested at your doctor. Not all physicians are doing it. Some are. So most of the time I would start with that coronavirus.utah.gov website that I posted. Just the general website there has the testing resources. The health department will call, if you have questions, you can call the health department. If you are a positive case, the health department will call you once you're tested. Being lightheaded isn't really a common symptom for COVID. It doesn't mean it's not there. If you're having low oxygen, you'll be lightheaded. But by itself, it isn't necessarily one that comes up right away that we would test you for. If you're feeling lightheaded, they won't necessarily test you for COVID right away, but it can be a side effect of some of the other things. For the common cold, it kind of depends on the symptoms that you're having. You can feel lightheaded for a number of reasons. For COVID, they won't necessarily test you for just that single symptom. Things like shortness of breath, if I'm not getting enough oxygen, I can be lightheaded. We all do this, but if we stand up too quick, our blood pressure drops really quick and we become lightheaded. So it all kind of depends. That's not something that we look, it's not a single symptom that we look for when we're looking at COVID, but it can definitely be something that's caused by a side effect. I'm going to put the general website for coronavirus for Utah where that testing resource is. And this one you can navigate to a lot of other information about from the state. And this is one of the links that was posted in that PowerPoint that I will share. You guys can distribute if you'd like to distribute the resources are on there. But this website has tons of resources for testing, for information, for data, dashboards, for frequently asked questions, information in other languages, all sorts of stuff is on that website. It's a great resource. What other? Go ahead, Marianne.
I was just going to say, does anyone else have any other questions? Oh, there's another
headache. Headache. So if you're looking to be tested for COVID, that's not necessarily one of the main symptoms that you'd be tested for. It is definitely a symptom that we see in individuals who are sick. It's something that's a little bit hard to nail down because we often have headaches for other reasons. So if you simply have a headache, just that's the only symptom you have, you can't rule out COVID, but it's not going to be something that they test you for. Just like, with the common cold or flu, that might be how it starts, and then you get another symptom, but it's not the symptom that they'll test you for. So that's a hard one. That's a hard one because for me, like I have chronic migraine. I have headaches all the time. I have to kind of take that one off the table. That's not something I look for. So it's one of those things you kind of have to assess your own health as you go. I'm glad I could clear up some of your confusion. I know there's a lot of information out there. When I send my PowerPoint, it will have my phone number on there. If you have further questions, feel free to reach out and we can go over it. Note that COVID information and COVID research changes often. The mask mandate statewide, so the way that the legislation works right now is the governor can set a health mandate, the state health department can set a statewide mandate, the county can set a health mandate, but we need approval from the governor. So Salt Lake County is the only county that has a mask mandate countywide. That has been set up by us. So there's a couple other counties that also have mask mandates that have been approved. Sorry, I didn't make that very clear. It's not the only one with a mask mandate. Utah County, for example, they've set Orem and Provo have a mask mandate. Those are the two cities within the county. Grand County and I'm blanking on the other one or not. I have to look at them. Grand County, for example, has a mask mandate as well that's countywide. So it's all going to depend on the county that you live in and looking at the state order. On that coronavirus.utah.gov website, there is a section on there. Sometimes you have to dig around for it. I don't know off the top of my head where it is, but they do lay out the health orders and it spells out which county and cities have mask mandates.
Thank you, Molly. Are there any?
Yeah, you're very welcome. I will send you that PowerPoint and you can distribute however you want. Like it's got my information on it, and if they have questions.
Okay, awesome.
All right.
Yeah,
All right. Well, thank you,
Molly.
Yeah. Have a good day.
Yeah, thank you. I also wanted just to draw your attention to the webinars we have coming up. We do these every Tuesday at 2 o'clock. Next week, we're going to have a representative from the Salt Lake City FBI office. They're going to talk about election security tips, which a lot of, as you know, talk about making sure our election is secure this year. So that'll be next Tuesday. And then on October 20th, we're going to talk a little bit more about COVID. Another representative from the health department. They're going to talk more about the research and the vaccinations that are being researched right now in regards to COVID. So that will also be a really good one. And then the fourth Tuesday of the month, we always do one in Spanish. So it's about ways to eat healthier, and it's lead by Erica. So that will be the one for the last week in October. So just wanted to make you aware of that. But I just want to say thank you for joining us today, and hopefully we'll see you next week.